Welcome back, folks. February is not only Black History Month, it's also American Heart Month. And that makes this month a crucial time to talk about heart disease and how it hits Black women particularly hard. Black women are 50% more likely to suffer from high blood pressure than white women, and it develops for them earlier in life. And among all women 20 and older, nearly 59% have cardiovascular disease, according to the American Heart Association. So let's bring in Scripps News Tonight medical contributor Dr. Omer Awan. Dr. Awan, this racial disproportionality of high blood pressure in Black women, I'm curious to know, this is something that we talk about, disproportionality when it comes to different issues, diseases, things of the like, but specifically when it comes to heart health, why does this exist?
Well, there's so many reasons, Christian. We can talk about, the biology of it. We can talk about access to care, but something that we don't talk about enough is the effects of structural and systemic racism. And the reason why this is so important is because when this racism gets internalized, it leads to states of high stress and chronic stress. And we know that stress is associated with higher levels of blood pressure, heart disease, heart attacks, stroke. And we should really ask ourselves, why is it that, Black Americans or Black women are denied pain medications way more commonly than white women? Why is it that Black women are offered screening exams much less likely than white women? This has to do with the biases that are present in healthcare workers like myself. So I'm calling myself out. I'm calling my colleagues out. We have to do a better job in decreasing these biases and these health disparities.
We've outlined some of the issues. Dr. Awan, what could be done to address some of this stuff? How do we close the gap on those disparities?
Well, I think one thing is we need to have much more sensitive, culturally competent care. What I mean by that is decreasing these biases, having implicit bias training. I think that would be a huge thing for healthcare workers and professionals, and just making access of care more widespread, allowing, marginalized communities to have better access to screening, more affordable medications. All these things would play a huge part in decreasing these disparities, and even having more Black physicians. I think the more Black physicians there are, the more likely, Black American patients are going to be able to relate to their doctors, the more likely they're going to be heard by their doctors. And then this will automatically decrease disparities and hopefully lead to better health outcomes.
I imagine that some of this can be pretty arresting for Black women who are watching this show and wondering about their own heart health. What are some signs of heart disease to look out for, and what are the sorts of tests doctors can run to check for that?
So, there are a lot of, risk factors that can lead to heart disease. So things like, being overweight, physical inactivity, having a sedentary lifestyle, having high blood pressure. All these things are, important, risk factors. Unfortunately, Black females tend to have this at higher rates than almost any other demographic group. But, typical signs, for example, of a heart attack would be, having chest pain that radiates to your arm, being nausea, fatigue, sweating, being short of breath. All these are heralding signs of having a heart attack. So if you have any of these signs, you should immediately and automatically go to a healthcare facility, potentially the emergency room as well. So all these things are important heralding signs that, something may be wrong. But, ultimately what we need to do is, take better care of ourselves, control the things that we can control. That obviously means, getting better exercise, eating better, decreasing the amount of sugars and carbs that we take in. And these are all powerful tools to help us have better heart health.
Yeah. As a note for the audience, heart disease is the leading cause of death in the U.S., and it's been that way for more than a century. Scripps News Tonight medical contributor Dr. Omer Awan, thanks as always. And folks, we'll be right back after this break.